Thanks, Ted. For most, when listening to music, it seems to do something to them. It moves them, evokes a certain emotion, or just plain makes them want to dance. But could music really have the power to heal, or at least improve mental or physical health? Well, joining us this morning to discuss just that are two music therapists from two of the world's leading health organizations. Christina Wood from Mayo Clinic and Healing Rhythms Music Therapy, and Lisa Gallagher from the Cleveland Clinic's Arts and Medicine Institute. Both of you, welcome to Fox in the Morning.
Thanks, Nick.
Now, I can understand you're from the area, but I wish I could say you flew in just to do this interview. But tell us really why you're here, Lisa.
We're here for the Great Lakes Regional Music Therapy Conference.
Okay. Tell us a little bit about what's going on up there this week.
So, over 300 music therapists coming in from 6 different states, Ohio, Michigan, Indiana, Illinois, Minnesota, and Wisconsin. And it's time for continuing education, networking, and we conduct our business meetings.
And music therapy, I mean, music and therapy are kind of two really broad terms. What exactly is music therapy for people who may not be familiar with it?
Sure. I think of music therapy as our role as clinicians to really empower people to utilize music to help them attain goals, whether it's pain symptom management in a medical setting, maybe it's a child with special needs in a school setting working on functional daily living skills or address, that type of thing. So really looking at big picture health, wellness, and how do we utilize music to help them achieve those goals.
Mm-hmm. So give us an example of what is a typical day, or if there is a typical day for a music therapist, Lisa?
There is no typical day.
Okay.
Every day is a little bit different.
Mm-hmm.
In a hospital setting especially, because you never know what has just happened in the room before you walk in.
Sure.
So when we walk into a patient's room, we actually assess to see what's going on. We ask them to rate their pain, anxiety, depression, shortness of breath, mood. And so that kind of gives us a start.
Okay. And then with music therapy, is it a separate thing where it can heal on itself? Does it work in concert with actual medicine? I mean, tell us a little bit more about that.
Sure. We say that we want to have an integrative approach and working together with the medical team, not that it's a sole answer of treatment on its own, but we really work together with the interdisciplinary teams and with physicians and nurses to make sure whatever goals we have for the patients can be met, whatever that goal might be for pain management or anxiety or procedures. So our goal is for the patients and optimally to promote their health and wellness.
Okay. So tell us, when you're interacting with the patient, I mean, what are some of the things that a music therapist may do?
Sure. Well, the first thing we do is find out what kind of music they like.
Okay.
Because a patient's preferred music will be the best music for them.
Okay.
So in one room it might be gospel, and the next room it might be hip hop. So
not necessarily Mozart all the time.
No,
That's
I'm sorry. Or Mahler.
Okay, or
Yeah.
Mahler. Okay,
Yes.
Thank you very much.
You're
all right.
welcome. Yes.
Because that is a common misconception. It's a soft, quiet music. Some people may like Metallica.
Exactly.
Okay.
Exactly. And then we try to engage the patient at whatever level they can engage. For some, it might be just listening. Others might be willing to sing along with us or play an instrument, write a song. We might come up with a relaxation script for them and teach them relaxation techniques and teach them skills that they can use when they go home as well.
And are there any benefits to people that aren't necessarily in need of any sort of medical attention? How can people learn more about the benefits of music therapy on their own?
Absolutely. One thing that I love to do is teach classes to the public on how to utilize music for wellness or to help promote sleep. We really are the experts in terms of our clinical training. How do we use music to do these things and to help you in your daily living and promote your overall quality of life? So those are some of my favorite things to do as well.
Great. Well, this has been one of my favorite things, having you both on. Two experts in the field from two of the, like I said, the world's leading health organizations. It's a first on Fox in the Morning, and hopefully not the last time. So thank you, ladies, very much.
Thank you.
Welcome.
And of
Thank
course,
you.
if you want to find out more information about all the things on music therapy, all you have to do is go to our website, which is right there, myfox47.com/mornings. We'll be right back right after this.